Hey guys, it's Abaid from Clear Canal Clinic, and this video is of my sister's other ear, removing all her earwax. I'm not sure if you saw my recent video. If you haven't, then go check that out. So you can see this ear was also pretty jam-packed with earwax, and couldn't hear much from this ear either. Put some olive oil drops in a few hours before removing this, just to help make it a bit easier to move, because you can see it's really plugged in there, really tough to move. So I hope you guys enjoy watching this earwax removal. Now, there's a lot of reasons why someone can have earwax like this. Everyone produces earwax, but for some people it just tends to sort of build up and accumulate and becomes impacted against your eardrum, which causes all the sort of symptoms of earwax blockage: hearing problems, itchiness, discomfort, all those kind of things. So there's a lot of reasons why it can happen. So for example, one could just be purely genetic. Some people just tend to produce more earwax naturally, and they produce it faster than it can migrate out of the ear, which causes it to all build up and become a big blockage. Some people have, a sort of abnormal skin lining in their ear canal, which doesn't move properly in that conveyor belt fashion that the cells move in the ear canal, and just prevents it from moving out of the ear as normal. Some people just have really narrow ear canals, which can cause the earwax to get impacted. Some of you are quite naughty and use cotton buds. Some of you just have a lot of ear hair, and that can trap the earwax and prevent it from escaping. Some people also have produced really dry or hard wax, which just sort of stays in the back of the ear, builds up, and slowly over time it becomes drier and harder, which makes it more difficult for it to move out of the ear. Some people also, have problems with their hearing. They wear hearing aids, and that can sort of just cause it to block up from things consistently being in your ears. Some people wear their AirPods or other earbuds too often, which causes a similar effect and can cause earwax blockage. So you actually notice more people who are younger. Normally earwax blockages are an issue for elderly people, but now with the surge of AirPods and all these other earbuds, young people tend to have earwax blockages as well. So you can see in the video now that we've taken out majority of the earwax blockage that we started with. Just a few leftover bits on the left side there on the ear canal. Had a quick look in there, and now we're going to try get it out. This was sort of a mixture of earwax and dry skin, making it quite difficult to just get off the ear canal. But it was, we're in there, so we might as well just get rid of it. Won't be impacting patients' hearing or anything like that if you do have this kind of wax, but might as well get it removed while you're there. See this part of sort of flaking that's not coming off nicely, being a bit difficult. So I think we just move over to the part on the left there. Yeah, exactly. We just tried to get that out in one big chunk, which it doesn't really want to do, but coming out in sort of smaller little chunks there. At this point after here, I think I sort of just keep going at that little flap of dryish skin. Really, I probably should have gone at that base of the earwax that you can see down there. Probably would have made my life a little bit easier, but at the end of the day, it's all about the end result, and that the patient feels all comfortable. Well, not patient, my sister in this case, but yeah, you can see we're almost all done. Ear canal's all clean, more or less, and my sister can hear again, which is good. I'm going to show you guys how much earwax we removed from both ears just now. Hope you guys enjoyed this video. If you guys are interested in having your ears cleaned or earwax removed, do give us a DM or send us an email. Be happy to get back to you. Bye bye.